joining me today. My name is Sarah-Jane Schofield, and I'm at Lakeshore Vein and Aesthetics on Lakeshore here, and I'm joined today by Dr. Janna Bentley. Thanks for joining.
Yes, my pleasure.
So today we're going to talk a little bit about skin products that are offered here, and just some makeup as well, just for any kind of skin types. So I'm in my later 20s, so I don't really have a skincare regime. So what would you kind of recommend for me?
Okay, so this is awesome. We could start at the very beginning. How would you describe your skin? Is it dry? Is it oily? Is it combination T-zone?
Combination for sure.
Okay, and do you have little breakouts sometimes?
Yeah, certain times in the month.
Okay, yeah, so that's very typical. And we live in the Okanagan, so we have to factor in that as well. What is your routine? You just wash your face and that's
Pretty much, yeah.
Okay.
Maybe a little bit of lotion
Okay.
at night, yeah.
Well, there's something very simple to remember about skincare, the ABCs of skincare.
Okay.
So regardless of your skin type, but we can modify within the A's, the B's, and the C's depending on your skin type. So the A stands for retinol or vitamin A.
Okay.
And it's not taking a vitamin. You actually have to apply it to your skin. And so retinol, and there's a range, or retinoic acid, there's a range of concentrations, and often will start you low just so that you can get used to it. And it is something that is crucial to everybody's skincare. It's an antioxidant, so it helps protect against skin cancer, because it is going to help with the free radicals that are coming at our skin and trying to mutate the cells, which does eventually lead to cancer, and it also leads to aging. Mm-hmm. It also is an exfoliant, so it's going to help with cell turnover. There's different layers in the skin. So the outer layer, the epidermis, that's the one that is shed when you apply retinoic acid or retinol. And so that's why if you start with too high of a concentration, you might get really red and peely and think you're having an allergy when it's just that you've been putting too much on. And,
okay.
And so we have ways of helping a person when they're just starting out so that you can ease into using it every day. That's the goal.
Okay.
So the B is for a broadband sunscreen. So there's different levels of UV radiation, and that is what damages our skin, causes pigment, also eventually can lead to skin cancer. So there's UVA1, UVA2, and UVB. And so if you can apply something that's going to block those, that's what broadband sunscreen means, then you're going to protect yourself. And I think the Canadian Dermatological Association recommends at least an SPF 30.
Okay.
I think that's the same in the States. So that's the minimum level if you're really trying to protect your skin. You think about a day like today where we're in the spring, it's overcast. Should you still be wearing a sunscreen? I think it's good to have it as part of your routine, but maybe a 15 might be okay at this time of year. But if you're really trying to protect your skin, you want a 30.
Okay, so you should kind of wear it every day.
I think so.
Yeah, okay.
And so if you have some sort of a foundation that you might wear, a mineral-based one, like we have Jane Iredale in the clinic, and it's a brand of makeup. It's a good quality one, and if you have a foundation that has that mineral base, it's going to be an automatic protection for you.
Oh, that's amazing then.
So you don't even have to think about it. And then the C would stand for vitamin C, and we're talking about topical vitamin C again. You can't eat a lot of oranges and expect your skin's going to be nice. You need to actually apply it. The other name for it is ascorbic acid. And again, if you're kind of acneic and a bit prone to acne, we need to be careful about your strength of vitamin C, because it can trigger blackheads and that kind of thing if you're using too much of it. And that's the one that you might have heard is a serum. So that means that it comes in an oil dropper form usually, and it will discolor the longer it's been open.
Okay.
So if you have a vitamin C that doesn't get darker if you've had it open for a few months, it's not good quality.
Okay.
So
good to know.
Yeah. It'll still work once it's changed color, but it's not as effective.
Okay, so is there any kind of anti-aging routines that you would kind of suggest? Like at my age, I need to start thinking about that, unfortunately. But
so all those things
are
anti-aging.
Okay.
Yeah, all of those things are anti-aging. So those would be your basic things that everybody should do. And again, choosing within your A, your B, and your C for your skin type. As far as the sunscreen goes, if you're a bit acneic, you probably want to choose more of a physical sunscreen, or some people call them an inorganic sunscreen, where it has the titanium and the zinc in it. And we have really nice quality ones where they're micronized, and it means that the tiny little bits of titanium and zinc are so small that it doesn't go on like the zinc of the past, where you had like streaks of white and you couldn't rub it in. So we can choose a good quality one like that if you're prone to a bit of acne and breaking out.
Okay.
Yes. So
can you tell me a bit about some of the products that you do offer here?
we have a lot of them. Where to start? This is an interesting one. So we carry 2 brands in general in our clinic. So we have Vivier, which is Canadian, and that's one of the big reasons we like it. We want to support Canadian products, and it's excellent as well.
That's amazing.
Yeah, and then we have Skin Medica, which is another great brand of skincare. It's had a lot of scientific development behind it. It's good quality as well. So with Vivier, they have, one of their claims to fame would be the grenzine.
Okay.
And so when we talk about the layers of the skin, you've got the epidermis and the dermis, but there's actually a tiny little layer in between them called the grenzone, and this actually goes after that. So you've got your exfoliant type things like the retin A, where it causes a bit of peeling with the outer layer, and also then you've got both your vitamin C and your vitamin A, they go after the dermis, which is kind of like the meat of the skin. It's where the blood vessels are and all that. And then you've got this that helps with that middle layer.
Interesting. So, honestly, skin has a lot of layers, but it's so actually complex.
Yes.
I don't really think about it all the time.
Yeah, so if you can approach all of them for anti-aging, that's the best possible scenario.
Amazing. And so how many times a day would you recommend someone using this?
Something like this? Usually twice a day. Some of them are once a day. So with the retin A, or the A in the ABCs, that one is usually applied at night.
Okay.
The vitamin C is usually applied morning and night. And something I'd like to mention, because I think there's a lot of misinformation about retin A out there, that you can't use it in the summertime.
Okay.
That's not true. You might not want to start it right in the middle of July when you're going out to the beach all the time, because it does cause that exfoliation, and it could make you a bit more sensitive to the sun. But overall, if you've been using it for a while, your skin is healthier, and your skin will be more robust when you're in the sun. And if you think about people who live in California, as if they're stopping their retin A during the summer, like they're going to keep using it.
Pretty much,
or in Australia, where they are really pro skincare because they have so much sun and their ozone layer is thin and all of that. They would be using the best skincare possible all year. Okay.
Good to know. Awesome. Yeah. So for myself, what kind of under eyes or anything that you can kind of use for me? That's something that I kind of want to look into. But
okay. So we have a few approaches to that. With skincare, so that's some of the thinnest skin in your body. And we have a muscle that circles our eyes. It's called the orbicularis oculi. And because that skin is so thin, it sort of shines through and looks dark. And there's also blood vessels running there, so that's another reason. And if you're dehydrated or tired, that seems to stand out more. And then as we get older, it gets thinner. And so that's why it gets darker. So if you're kind of an allergic person, you've rubbed your eyes a lot, people like that are more prone to dark circles.
Okay.
But with skincare, we have one of our skincare, we have a dark circle eye cream right there. And it actually has topical vitamin K in it.
I've never heard of that before.
So it helps constrict the blood vessels that are running under there, so they don't add to the appearance of the darkness.
Oh, cool. That's interesting, actually.
Yeah. So that's one thing. Also, you bring up a good point there. When you're talking about skincare, like your A and your C, so the ABCs, the A and the C, the retin A and the vitamin C, you can't put what you put on your cheek in your eye area, your periorbital area, because that skin is so sensitive, you're going to peel like crazy. But another thing, if you can make that skin healthier and more robust, if you can get a retin A or a vitamin C that are allowed to go in that area, you're going to reduce the appearance of the dark circles too.
Oh, that's super neat. I didn't know anything about the constriction of the blood vessels in your eyes. That's really neat.
As soon as you stop using it, it's not working anymore.
Right, makes sense.
The other thing we have with the Jane Iredale makeup, they have good under eye concealer there too.
Okay, that's good to know.
And then we have the fillers, which
Okay.
can really make a big difference, but they need to be done properly in order to give you the best results.
Okay, awesome. So is there anything else you kind of like to touch on? Or just kind of thinking for other people, different kind of skin?
Yeah.
Because mine's a very, we said, it's combination skin.
Yes.
So it can be like when the weather changes in Kelowna, like it gets dry.
Yes.
And then it can get a little bit on the
Yes.
greasier side too.
So my skin is probably a bit like yours, but I am older than you by a generation. I like to use, there's a Vivier moisturizer, because I think with all this you need a moisturizer too.
Yeah, for sure.
And the moisturizer that our parents might use would be too strong for us. So we do have an oil-free moisturizer that's really good, but the one that I like is in the Vivier line, and it is called Lexil, and it actually helps with redness too.
Okay.
So it helps with, if there's a bit of inflammation going on in your skin, it helps to dampen that, and it's not too oily.
Okay.
Greasy.
Yeah. So going on to your makeup that you offer here, is there any kind with like foundation, like types of foundation that you would recommend to help the skin, or?
So anything that protects you from the sun is going to help your skin. I don't think there's a makeup product that is going to work on your skin, but it can protect your skin.
Right.
So I don't like the look of a lot of makeup, but something that is mineral based. And so it can actually put a layer on there that is a sunscreen. That's going to be and we have different kinds depending on your skin type. So if you're young like you, you'd probably want a lighter one, I would expect. It has to cover less, but give you the protection.
Yeah, okay, awesome.
Yeah.
So that's good to know those different kinds of, not thicknesses, but
Yeah.
kind of thing of moisturizer and foundation.
Yes.
So, neat. Okay, awesome.
And I was going to say, I don't know much about makeup, but maybe I know a little bit.
Yeah. So how would someone go about having these products or anything like that?
Good question. So our team actually knows way more about this than I do. This is not usually part of my role at work. We have a patient care coordinator, and also all of our staff are trained in skincare. And so if you want, you can book a consultation. It's no charge, and you can come in and be assessed and talk about your needs. We have been putting together little sample packs actually that people can purchase, and then you're not, because this skincare is, it's worth its value, but it's more than you might get at Walmart.
Right.
I'd say it's comparable to the Bay. So if you're going to go and buy skincare at the Bay and the higher end Shoppers Drug Mart, you're going to be spending what this is worth, but it's nice to be able to get some samples where you're not spending too much until you're sure you really want to do it. And so we would match you up with what is good for you, and then do a follow-up and see how you're doing, and then you can decide what you want to purchase.
Okay, that's so cool, because obviously, like you said, everyone has some kind of skin type, so
Yes.
you don't know until you try, right?
Yes,
So,
and this is for all comers, really.
Okay, amazing. So thanks everyone for joining today. We're here at Lakeshore Vein and Aesthetics, and thank you, Dr. Bentley, for joining us as well. Thanks for tuning in to Be the Best Version of You.